delighted to introduce you, Mohit, and I should shut up so you can get started.
Hello, good afternoon, everyone. It's really, I'm really glad to be here presenting a topic of research. I'm a PhD student in I'm in my third year, almost about to finish in 6 months. So I'm going to present in as simple way as possible my topic of research and make it more understandable. So my research is based on developing targeted therapeutics for cancer and more specifically rationally designing my drugs because what we face today for cancer therapies, it's really unfortunate because cancer therapies have been really bad, I would say. I'm Mohit Jain, by the way, and I'm in Division of Pharmacy. So I'll start off as the way up the right one.
That way.
I'll introduce cancer. So cancer, as of 2011, is the leading cause of death worldwide. Over 8 million deaths worldwide, surpassing heart disease. And one of the main reasons has been the lack of therapeutics and the side effects related to it. And that's the main cause of mortality. So I'll introduce cancer in general, saying cancer is a group of diseases in which abnormal cells divide uncontrollably. What happens after that? It invades to nearby tissues. As you can see, if the cancer starts from liver, they can invade to nearby blood vessels and spread to other parts of the body. And then the spread itself is called metastasis. And this diagram here shows that it started from intestines and then it spreads to lung and then to brain, and that's called lung metastasis. And that's the main cause of mortality because there's really no proper treatment to stop cancer at later stages. And there are more than 200 types of cancer. So the treatments also differ for different types of cancer, and it's really hard to treat at the same time. And my main cause of research, main focus of research is the brain tumor. So I'll give you a bit of research background. Glioblastoma multiforme, which is the advanced stage of glioma, and it's the aggressive cancer of the brain with poor prognosis, with median survival rate of 15 months only. And once it comes to that stage, what happens is therapeutics strategy limits. And this is the MRI scan of a patient with brain tumor. As you can see, this is the brain tumor. And main problem here is there are insufficient treatment options. So treatment options are surgery, chemotherapy, and radiotherapy. And they are not enough because treatment options itself, they are restricted by unavoidable toxicity to normal brains, normal cells. And what causes that? That causes different side effects like headaches, nausea, immunosuppression, your immunity decreases and you're unable to do any work because of the treatments. And then presence of blood-brain barriers. So there is a blood-brain barrier in the brain that allows specific molecules to pass to the tumor site, and when that doesn't happen, drug doesn't reach the target site and it actually goes on killing the normal cells itself, which is not good. And the drug itself causes resistance. So tumor will have resistance to the drug eventually, and that causes treatments to be limited. And what my main focus of research is the need for improved therapeutic strategies, which is tumor selective. So how am I going to do that? Because I need tumor selective therapies, I need to target just the cancer and not anything else. What I can look at is the anti-tumor drug target. If I can target any factors in the cancer that are present and not in normal cells, and if I can target them specifically and kill the cancer selectively, like a smart bomb, So what you can say is, there is a normal cells, just general how cancer spreads, and there is tumor cells in between, and they slowly spread through the basement membrane. So what happens is, these are normal cells. When tumor starts growing, they will cut through the barrier and then slip out. And once the cells start coming out, it will invade to nearby cells and then slowly spread to other parts of the body. And this is caused by one of the proteins called matrix metalloproteinases. We'll call them MMPs. And they are a family of 27 enzymes. And what happens is, when there is low expression of MMP in normal cells, and they have high expression in brain tumor. And when they are expressed at high levels, what they cause is they degrade this membrane, and then slowly they invade to nearby tissues, invasion and metastasis. And once it's invaded and metastasized tumor, the therapies can't reach specifically to the cancer. So what I can do is, I can exploit these factors called MMPs, because they play important role in different hallmarks of cancer, and they have ability to cut amino acid sequences. These are small sequences of proteins which they can cut selectively. So what my strategy here is to exploit their functionality to target the tumor. And this is based on the concept of prodrug. So prodrug is a superior form of a normal chemotherapeutic. Prodrug consists of an end cap, protein sequence, and a warhead. Warhead here is a chemotherapeutic. So you can use any chemotherapeutic which is normally used in cancer. But what we'll do is, we'll add this chemotherapeutic to a protein, which what then causes is, it inactivates the warhead when it's attached to the protein. And this prodrug concept is selectively activated within the tumor by MMPs. Because we know that MMPs selectively cut the protein, I will use that ability. So what happens is, in the tumor, MMPs are released, and that causes the protein to be cleaved by MMPs, and then it selectively releases the warhead within the tumor, and then causes a therapeutic effect. Whereas in normal cells, what will happen is that, since there is no MMP in normal cells, there will be no effect. So this is a concept where it will selectively target the tumor. And it does not inhibit MMPs, because I don't want to inhibit MMPs because they are involved in a lot of host-protective functions as well. And that can do is, once I target the MMPs within the tumor, they will selectively reach the tumor site. And this has therapeutic potential and scope because it's a platform technology for developing targeted therapeutics. So what I've done is, to make these tumor-selective prodrugs, I've rationally designed these peptide sequences which can be selective for MMPs. So I've used 3D computational chemistry for rationally designing the drugs. This I'll show you a simple diagram of hand and glove model. So this is the MMP, which can be said it's a glove, and the peptide sequence is a hand. So I have modeled these sequences into the MMPs, whether they can fit into the glove of MMP selectively. And what that does is, once it fits selectively into the MMP pocket, it should be selective more for MMPs. That means it will be selective for more for tumors. And this is a 3D model where which it represents MMPs and the chemicals sitting into the pockets selectively. And that's rational drug designing, because you have a chemical sitting into the glove selectively, and that's a very good chemical. And that's an inventive and revolutionizing approach for drug discovery. So I've utilized this 3D computational chemistry for developing tumor selective prodrugs. This is my one of my prodrugs that I have designed rationally with doxorubicin as a potent chemotherapeutic attached to the peptide sequence, which I showed you before. So this is the warhead, this is the peptide sequence, and that's the end cap. So what that does, once that was designed, what that does is it inactivates the doxorubicin. So once it's attached to this peptide, it inactivates the doxorubicin. And it was synthesized and purified, and then it's ready for testing against anti-cancer for cancer cells. So what was the effect of prodrug in cancer cells? So as you can see, I tested the prodrug and the doxorubicin alone on cancer cells. So doxorubicin alone had a novel effect, novel killing the cells, because doxorubicin can kill cells without any selectivity. So it killed the normal brain cells and also brain cells, also brain tumor cells. What happened with the prodrug is, with the brain tumor cells, it had the anti-cancer activity, whereas in normal brain it had no toxic effects. So that's proving my proof of concept that a rationally drug designed model worked, and I have selectively made a prodrug which is selective for brain tumor cells and not for normal brain. And as you can see, these are the IC50 values showing that in normal brain cells, the prodrug wasn't toxic at all. So it was toxic to MMP positive cells, and it was not toxic to normal brain cells. So what is my therapeutic strategy? Because I know that there is difficulty in targeting the drug to the brain, because systemic drug delivery to the brain is impossible because of the blood-brain barrier, because it can't reach the target site. So what my strategy is to develop a prodrug implant. Because 90% of the tumors reoccur after surgery, what I can do is, once after the surgical resection, there would be some residual tumor mass, because a surgeon would never remove the whole tumor within the brain. There would be some part of the tumor left, because it doesn't want to, because some of the tumor has gone into the normal brain cells and it doesn't want to affect any normal brain cells. So some of the tumors will still be there in the tumor site, and that's the problem of tumor recurrence. And this prodrug implant is a strategy for stopping the tumor recurrence. And the future objective is to place this implant post-operative, after the post-operative surgery, to halt the tumor recurrence. And this has the potential to improve success rate of brain chemotherapy. So with the drug discovery timeline, I would say this drug is currently at preclinical stage, and takes about 5 to 7 years to go into clinical trials and then into the market. So currently it's in preclinical development, and hopefully it will be successful. So in summary, what we have learned is prodrugs can overcome chemotherapeutic limitations. MMPs are viable targets for prodrug development. Rationally designed, so we rationally designed and synthesized these prodrugs of potent anti-cancer agents, and that provided a proof of concept that prodrugs are tumor selective, they lack toxicity in normal cells, and prodrugs remain stable in MMP negative environment. And the future work is to develop a prodrug implant as a therapeutic strategy for brain tumors.
much.
Okay, don't go. But I depend upon others in the audience asking you bright questions. I think my question would be particularly bright. So, questions for Mohit, please, from the back.
I was just wondering, in your experiment, was the cells that the drug was tested on, was that human cells in culture or was it an animal model?
It was a human cells in culture.
Okay.
So it's a preclinical culture, in vitro culture.
Okay.
Sorry. How do you make sure that your drug, like, it connects with the peptide? Do you tag them? Like, do you stain them to see
To
that?
find out, okay. It
Before
was
you
done.
answer that, can I just ask, did you hear the question all around the room?
I sort of heard half of it.
Sorry.
Something about
So-
binding something to something, but that was about all I heard.
Would you,
Okay,
would
if
you
I'm-
like to just reiterate the
Okay,
question?
if
as your
I'm-
voice is
if I'm not
very
wrong.
clearly.
She asked, how did I confirm
Yeah.
how the peptide has attached to, like, a prodrug is formed, basically. How did I confirm that? It was confirmed using LCMS. It's a technique utilized in Department of Chemistry. What you do is you put that drug solution into the instrument, like tiny bit, and then after a while it shows different peaks. And with those peaks, what happens is those peaks gives like molecular weight of those drugs. Now I already know that what the molecular weight of that chemical is, so I can correlate with those peaks, which of the peaks correlate with my predicted molecular weight. And then that particular peak, I select that and then purify that peak. So it's more into chemistry. Yeah, I mean, I didn't include that just to keep it general, but yeah, that's how it's confirmed using LCMS.
I'd say that was a pretty specific response. Thank you very much. Are there any more questions for Mohit? In that case, Mohit, thank you very much indeed, and I hope you will be staying for the rest of the day for lunch. So if there are more questions over lunch, then don't hesitate to catch up with Mohit and ask these bright questions about these very important things.